Greetings, my name is Dr. Martin Chavez. I'm the Director of Maternal Fetal Medicine and Fetal Surgery Program in a very busy practice. On a typical year, we do over 30,000 ultrasounds. We have over a dozen sites, we have close to a dozen maternal fetal medicine specialists, and over 20 perinatal sonographers. Today, I have the pleasure of sharing with you our experience with HeartAssist, a Samsung product, which utilizes artificial intelligence, which allows us to be faster and teach our team members and improve our skills. That's probably the most exciting part for me, is because this one particular tool allows us to do multiple things in the sense of education, in the sense of time saving, in the sense of not compromising the quality care that we provide for our patients. HeartAssist allows us really to change the dynamics of our patient interaction, particularly when it comes to looking at the fetal heart. It allows us to make sure that we are getting the most accurate image, which we typically try to do, but also it saves time when we're not having to label or measure the cardiac views. As you know, it's important to label when we're looking at the cardiac structures to make sure that who's ever reviewing the images, or we review it at a later time, we can accurately say, yes, that's what we're looking at, and that's what we get reassurance from. So when we first start our scan, we typically start it just like we normally would any other cardiac scan. We proceed in getting the typical cardiac views, whether it's a 4-chamber or whether it's an outflow tract, and we allow the system, utilizing artificial intelligence, to start labeling the images. So we'll start with a typical 4-chamber view. We'll hit auto annotate, and then it'll not only give us the reference that it has located, which is the spine, but also the chambers that it's visualized. We then can have auto measure, take measurements of all of those chambers, and we can tweak the measurements if we're not happy with them. Remember, HeartAssist is a tool. It is not a replacement for us. It helps us utilize our expertise. So here we have the ascending aorta, the branch of the aortic arch, as well as the descending aorta. As you can see on the upper right-hand corner, it's actually labeled it as the aortic arch. When we hit the auto measure, then we also get the typical measurements from the ascending, the transverse, as well as the descending, and the isthmus of the aorta. This in itself is a huge time saver for our practice as well as for anyone who does fetal echoes. The other feature that I sometimes utilize this for is when I do take a sweep, a cardiac sweep, where we start off at the top and then just sweep all the way down as we're getting those images all the way down to the apex of the heart. Now I can go back, start at the beginning of my sweep. In this particular instance, it happens to be at the location of the 3-vessel view. And then I can auto annotate, and it'll automatically measure, label as well as measure my 3-vessel view. And you can see on the top right-hand corner of the screen, it's already labeled as such. And I save and I move on for my next. Now, utilizing that same cine loop, I keep on scrolling down. And I can get additional 3-vessel views, or I can just continue going down. And it's recognized that this is at the level of a 3-vessel view, the tracheal view, because you can see that there's the trachea as well as the esophagus being visualized on the screen. But it doesn't have enough information to label the actual components of it. But it's still a time saver because it allows me to say this is a 3-vessel view, and I can continue to the next view that I need in the process. Sometimes I'll try to challenge the system and give it an image that looks like another image, but it recognizes components of what it should be. So a perfect example was that aortic arch. Even though I only had one branch being visualized, it still recognized it as an aortic arch. That goes back to that feedback cycle I spoke to you about and the importance of that, particularly when someone's learning, and how that will flatten out their learning curve and improve their ability to get the images that they want for their fetal echo images. So we're going to stop at this particular image, right? Making sure that you can see the valve there, and I won't identify the valve just yet, but I'll hit the auto annotate, and you can see, even though compared to the previous image where the left ventricle was in the completely opposite side and the aortic arch, or the ascending arch, was coming out of the different direction, it was still able to identify that. So once again, it doesn't matter about fetal position, it used their surrounding landmarks to identify that. So that's a perfect example, as even if the baby's moving around, it still helps you identify and label the areas of interest for the cardiac views. So we're going to stop there and take that image. And even though I'm trying to sweep closer to the aortic arch, it's still capturing part of the components of the aortic arch versus the ductal arch. Here we have a 3-vessel view. We'll scroll down. It's going to stop at a septal view, and we're going to continue going from there. Now I'm able to capture those images faster, with much more accuracy, to label them as well as to measure them. It's as simple as putting down the probe and doing what we normally do, getting the images that we need to get those cardiac views. And now we have an artificial intelligence system, HeartAssist, allowing us to label and get those views much faster and much more accurately. I want to thank you again for investing time in hearing about our story. As you can see, HeartAssist really is going to change the landscape as to how we not only label but measure our fetal cardiac imaging. It also is going to really allow us to enhance the education of our new team members, whether they're sonographers, whether they're doctors, fellows, or everything in between. And I personally believe that it's also going to help me and people of certain skill levels, because it's really going to push us to improve our imaging, to make sure that we get the best possible images for the AI to label accordingly. I think it's also important to realize that AI is all around us. AI is here to stay. AI is enhancing our skill. It's not replacing our skill, it's enhancing our skill. That's what excites me the most, that it's going to really make a difference, because it gives me more time to spend with the patient. It gives me more time in making sure I capture the best possible image. And just as important as all of those other things, also educating. Someone taught me, I want to make sure that I invest in teaching others. And HeartAssist is really changing the game when it comes to that as well. So again, thank you. I know you guys are all busy and you all want to learn as much as you possibly can for every time you invest on these type of seminars. So I appreciate it, and I look forward to talking to you at our next national or global meeting. Thank you.